I'm Dr. Manuel Astruc. I'm a board-certified psychiatrist. I help entrepreneurs who are suffering from depression get back to being energetic, productive, and very confident. Today I'm going to talk about treatments for depression. And when patients first come to me and they've never been treated for depression, and I've diagnosed them with depression or someone else has diagnosed them with depression, one of the first questions people ask is, do I have to take medications? I don't really want to take medications. Like, nobody really wants to start off with medications. And the answer is you don't have to take medications. The challenge is that depending on the severity of the depression, so depression comes in all shapes and sizes, so mild, moderate, and severe, and the more severe the depressive symptoms are, the more difficulty the patient is having with their ability to function and do all the things that they need to be doing day to day in terms of work, family, taking care of themselves. It can get bad enough that people end up in the hospital because they just can't take care of themselves. But if you're earlier on in the continuum and you've got a longer runway to try different things, trying alternatives is perfectly reasonable. There's a lot of evidence, for example, that exercise is a great booster for your mental health and for depression. One of the things I look for with alternative treatments is, first and foremost, like, it can't be dangerous, right? We can't be doing alternative treatments that are, number one, going to keep you from getting the treatment that you need if you're severely depressed. And number two, that you're not doing something, taking high doses of, let's say, vitamin E, which can accumulate in your body and become toxic, or vitamin A. But the treatment has to be safe. So exercise is generally a safe treatment. Things like meditation can be helpful with depression. There's patients who go and get acupuncture or chiropractic care for their depression. And these are things that you can try. They're not dangerous. They may not help, but if you've got the runway, those are not unreasonable things to try. Body work, things like yoga, tai chi, some of these like very, very ancient practices also can have benefit in terms of your mood and your mood regulation. So there's definitely things that you can try before medications. The things that I talk about with folks that are easy to do, or things that are easy to do, but they're also easy to not do, eat better, move more, and really focus on your sleep. Right? Sleep is the best performance enhancer that we have going out there. However, it's also one of the things that we see impacted with depression. It's one of the cardinal symptoms of depression, difficulty with sleep. What about psychotherapy as a treatment for depression? Psychotherapy is a validated, well-researched, helpful treatment for depression. People often will start with psychotherapy before they come to see me. And what psychotherapy looks like is making an appointment with a therapist, and the therapist can have various professional titles, psychologists, social workers, licensed mental health counselors. So there's a range of credentials that people have. What I tell folks is that the important thing with psychotherapy is that you have a good fit with your therapist. If you think about buying a pair of shoes, there can be like a wonderful shoe that doesn't fit well for you. It's important that you have the right fit for you. And then there's lots of therapy modalities that therapists use that can be helpful. There's an interesting story that I tell. There's a psychiatrist who was not a fan of medications. He liked to use psychotherapy for his patients. And the clinic that he was working at was an academic clinic, so it was in a teaching hospital. And I forget what the hospital was, but the psychiatrist, his name is David Burns, they had a long waiting list for people to get into therapy with the program. And he ended up writing a book. The first version of the book, which is probably 20 years old plus now, was called Feeling Good. And the new version of the book that came out last year, the year before, is called Feeling Great. So he must have learned something over the years. But they would give patients who were on the waiting list for psychotherapy the book to read while they were waiting. And what they actually found was that the book Feeling Good, which goes over what we call cognitive behavioral therapy, and it has a lot of items for you to be thinking about and being introspective around your thoughts and your feelings and cognitive distortions, fairly detailed. But that the book was helpful enough that a lot of patients ended up getting better before they ever needed to come into the therapy clinic when their time was up for them to start treatment. They didn't need it anymore. So psychotherapy is good, and bibliotherapy, like reading about stuff and working on yourself, that can be helpful as well. What about medications for therapy? The medications for therapy is where I tend to come in. I'm a psychiatrist. In my specialty, I certainly can do psychotherapy, but what I bring to the table that other folks who are working in the mental health field are unable to do is to prescribe medications. So psychiatrists and psychiatric nurse practitioners are the specialists nowadays in mental health who prescribe medications for depression. Now, that being said, most antidepressants are not prescribed by mental health specialists. The vast majority of medications are prescribed by primary care, pediatricians, OBGYN, and part of the reason for that is that that's who patients are first encountering, and those professionals are certainly capable of starting treatment. So I can start treatment, and sometimes do. More often, patients come to me when they haven't been doing well on the medications that they've had, and my job then is to evaluate, make sure that the diagnosis is correct, and then start to think about a treatment program in which we'll start thoughtfully looking at the options with what we can do to improve someone's mood. What I tell folks is that there's only a handful of things that we can do, but within those handfuls, there's lots and lots of options. So the big three buckets are, we can change doses, we can swap things out, or we can add things. Medications have been the mainstay of treatment since the 1950s, and we actually discovered medications serendipitously. It was just a lucky thing. The first psychiatric antidepressant was a medicine called isoniazid, and this was a medication that was actually used to treat tuberculosis. So back in the 1950s, tuberculosis was a problem, and people who had tuberculosis in their lungs would be sent to these sanatoriums where they could recover lung function and heal and take the medications. So these places where people went to get better were generally places that were warm and there wasn't a lot of humidity. And there's these classic great pictures of these individuals with tuberculosis in these community rooms, just smiling and laughing away and having a grand old time. And what they discovered, that these people were much happier because of the effects of this antidepressant that was kind of built in to the tuberculosis antibiotic. So completely serendipity that we discovered that. And from there, we started to discover other antidepressants. The next ones that were discovered are what we call the tricyclic antidepressants. That first one, isoniazid, is what we call an MAOI, monoamine oxidase inhibitor. And now what we commonly talk about are things like SSRIs, selective serotonin reuptake inhibitors, SNRIs, selective serotonin and norepinephrine reuptake inhibitors, and other medications. But there's been an evolution of the antidepressants that we're able to use, and we have a lot of them available to us, and we have a lot of agents that also can help to augment or improve the effectiveness of antidepressants when what you're on is not working. Where does TMS come in to the story with depression and the treatment of depression? So TMS has been around for well over a decade. The FDA first approved TMS, which is transcranial magnetic stimulation, as an approved modality for the treatment of depression 10 years ago. And the context is that it's been approved for what they call a treatment-resistant depression, which, according to the FDA, means that someone has failed one prior medication. And the studies that were done focused on placing a strong magnet, like in a MRI, very close to the brain, in a part of the brain which we call the prefrontal cortex, and applying magnetic stimulation pulses over time. And it was discovered that patients who had not responded to medications were responding to transcranial magnetic stimulation. It was a remarkable discovery, and nowadays there is so much research going on to see if transcranial magnetic stimulation can be used for other disorders. And we're also able to study things like, how frequent the pulses are giving, how long they're giving for, the interaction between, giving a set of pulses and then giving a rest and then giving another set of pulses. All these variables can be mixed up, how long you do that for in the course of a treatment session. Currently, the protocols that we're using for depression are 5 days a week, 30-minute sessions for 4 to 6 weeks. So there's an investment of time that people have to make in order to undergo TMS. The benefits, and we'll talk more about benefits in another video, but the benefits are really pretty remarkable in terms of being able to get patients into remission who haven't responded to medications. And there's a leading edge thought, and something that I'm incredibly interested in, which is, why do we have to wait till patients have failed medications to start TMS? There's really no reason why TMS cannot be used earlier and earlier in treatment to reduce suffering in people who have a lot of responsibilities and are not functioning at the level that they know they're capable of functioning at.